All right, well, hello everybody, and welcome to the webinar, which is all about getting staff back to the office safely. I'm Jim Preen, Director of Crisis Management at Udo Sentinel, and for those who don't know, we make crisis management and crisis communication software. Um, it's a bit of a tradition on these webinars, which I've been running for some time now, actually. In fact, Mark has been, one of my guests has been on before. Anyway, we'll get to that in a moment. But it's a bit of a tradition on these webinars for those listening to post in the question box where you're listening from. Also, I can then check that the question box is actually working and that you're going to ask me questions, because we're not going to have questions at the end of this webinar. We want you to post questions as we go. In fact, if you have a question right now for my guests about if you have any concerns or worries about getting back to the office or making sure an office environment is safe for your staff, and you want to post a question, then you post it right now, and I'm going to put those questions and your comments to my guests, and hopefully they'll be able to answer them for you. And indeed, talking of my guests, I'd like to introduce them right now. And here is a slide which tells you who they are. They are Mark Hoffman, who is joining us today from Canada, and Milena Maneva, who is joining us from London. And I'm in London too. Milena, could you tell us a little bit about yourself, your background, just to enlarge on this profile that we have here?
Yes, of course. Hi, everyone. Thank you for joining our session today. My name is Milena, and I'm keen to share my knowledge and experience on pandemic planning and help you with your key considerations for return to the office. I have over 10 years of risk management experience, and I'm a certified business continuity professional. In the past, I've worked for a number of sectors, including oil and gas, financial services, law, and the NHS, where I supported key stakeholders and executives with their resiliency planning and exercising. I'm currently a business continuity management lead for EMEA, and I'm based in Canary Wharf, London.
Okay, that's great, Milena. I have to ask you one thing that I put here in your profile because it fascinates me. You were raised in close proximity to a nuclear power plant, I should say, and you know the value of monthly drills. What's all that about? Interested to know.
Oh, wow. We were asked to actually exercise every month, and we were taken to these safe corridors, and we were asked to put these, big, heavy masks, which would prevent, nuclear kind of radiation going through. And you would need to practice that on monthly basis. And I would never forget those heavy, scary masks.
What
That
what what
was
what age were you when you were doing this?
Oh, I started from when I was 5 years old.
Oh my goodness, that sounds a little on the scary side. All right, well, thank you very much. Mark, could you introduce yourself as well? Tell us a bit about your experience, please.
Sure, Jim. Thanks for having me back. You're right. We had done this once before. I think we were talking about putting an effective cyber security response together. I've been doing this for about 20 years. I'm based just north of Toronto, and I have a little boutique consulting firm, and I help customers with crisis management and business continuity, kind of focus on program development and maturity, program assessments and things like that, as well as crisis management planning and cyber response planning. So right now I have customers in Canada, the United States, Europe, and the Caribbean, and a lot of things going on, obviously, with COVID-19, but also, part of the normal day-to-day job also continues. So you could say I've been busy.
Okay, yeah. I mean, just for our guests and for me as well, can you just tell us where Canada is in the whole COVID lockdown thing? I mean, in London, where I am, we're sort of coming out, we're easing out of lockdown. Now, whether we get locked down again, I don't know. Whereabouts are you in Canada? Is that the same kind of situation with you?
You startled me with the question there when you said, "Can you let everybody know where Canada is?" And I'm like, "Jim, Canada, it's the second largest landmass in the world. Everybody knows where Canada is." But then you
Thank you
continued,
very much for that,
yeah,
Mark. Thank you.
yeah. But so no, it's we're doing well. We're not done yet. We haven't done everything perfectly. It's easy in Canada to compare ourselves to our neighbors to the south. And we're certainly doing better than they are. We have just over 113,000 cases, I think it is, with about 9,000 deaths. The overall reproduction rate of the virus here in Canada is hovering around 1. It's been below 1.
Okay.
And we can talk about that later, but just a quick example of the difference between sort of the culture here and in the United States. So at Niagara Falls, which is at the border between the two countries, each country has a ship or a boat that they take down the Niagara River and sort of near the falls, not necessarily under the falls, but near the falls. And somebody captured a picture yesterday of the difference between the two boats. The Canadian boat had literally about a half a dozen people on it, wearing masks, all social distanced away from each other. And the American boat had 200 people on it, everybody all grouped together. So that's the difference between the two countries, and that's kind of how we're doing right now.
I mean, I mean, I don't want to get too deep into that. Is that just a cultural difference, or was in Canada they're not allowed to put so many people on the boat, or we, you know, or in America anybody can go? What's the difference? Is it a legal thing or is it a cultural thing?
I think it's a cultural thing. I think it's a leadership thing for sure.
Yeah.
And there's some COVID fatigue here, and we're going to talk about that more as we go through this. But yeah, I think it's just a whole different approach to doing things. I probably should leave it at that.
All right, there's a bit of boating and a boating update from North America from Mark. Guys, you're not putting in where you're listening from. Janet has. She's in Greenford. Hello, Janet. So if some others of you would like to put in where, there's quite a few people on this webinar now. So maybe you joined a little late. If you'd like to put where you're listening from, the country, the city, the town, we'd love to know where you're listening from. Now, moving on, I happened on a bit of research which I thought was quite useful for the topic, today's topic, and I just wanted to share this with you. So 2/3 of working Britons don't feel comfortable commuting to work via public transport. That's quite an issue, I think, and one that we're going to be talking about today. I wonder what you guys think about that. You know, how likely is, you know, using public transport going to put you off going back to the office? And more than half of people don't want to go back to working in an office environment, you know, the usual 9 to 5 in the office. Is that a thing of the past? And then more than a third say going back to work in a traditional office will impact their mental health in a bad way. And more than a third of UK workers say that when they return to the office, it will be a smaller team and people will handle varied responsibilities. I thought that was quite interesting. Hang on, we've got some more people. Oh, excellent. Alexandria is listening in from Loch Lomond. My word, that's fantastic. I don't know if anybody wants to break into song here. Probably not a good idea on this webinar. And we have Ilse from Cape Town in South Africa. So that's welcome to you all, and indeed everybody who is listening today. Milena, maybe I could just turn to you very quickly. Is there anything that jumps out from these stats, this kind of this research that I've put up there? Anything you want to comment on that?
Yeah, absolutely. I mean, it's fascinating how people feel about the current situation, and obviously the confusing messages from the government in terms of either are we allowed to go back to the office, can we use the public transport? At first we were asked to go back to work, but then we weren't allowed to use the public transport, and there are people that live really far out of London, and for them it will take them probably half a day just to walk, or maybe even a whole day. So the numbers will definitely vary from company to company. And you will definitely need to ask these questions and create these surveys on a regular basis just to see and assess how people feel. A lot of people will definitely feel more comfortable now that public transport will be made available from August 1st. And as we've seen, you know, retail shops have opened and there are new regulations. But ultimately, the numbers will definitely change and people might feel more comfortable there.
As they get used to it, I suppose. Yeah, okay. Well, those are kind of interesting stats, and we'll return to a lot of those topics in a minute. But the first thing I want to do, well, not the first thing, but what I'd like to do now is launch a poll, because what I'd like to know is are you back? Who listening today is actually back at the office? So I'm going to launch a poll here, and I'd really like you to vote, please. Hopefully you can see this poll now. please can you, is any, I'm kind of interested to know if anybody's back at the office now. So if you could please vote. Okay, this is quite interesting. All right, okay. Okay, anybody else? I think we're almost there yeah, we're there. So I'm just going to, okay, I'm going to share these results, and I'm hoping, can my guests see these results? Milena, Mark, can you see these results?
Absolutely.
You can. Okay, so well, there you are. We do have a few, 77% of people are not working, are not back at the office, and 15% are. I guess this is quite sort of typical, I suppose. But I tell you what I'm going to do. Before I turn to my guests, I'm actually going to launch yet another poll. I do like these polls. So I'm going to stop sharing those polls because these two are completely linked. So let me just find my next. All right, so I'm just going to launch this poll. So really, I'm asking the people who are back at the office is, how is it? Do you like being back at the office? You know, it's okay, but I'm not loving it. I want to return. Right? Anybody else want to join in on this? I know it's going to be this is going to be quite a small poll. Oh, well, it's quite instructive. Anybody else want to vote? I can see there's not everybody has voted yet. Okay, I guess people haven't voted because we know that they're not back at work. All right, I'm going to share this poll now because I don't want to hold up on this. So there you go, my guests, Mark and Milena, there you go. I'm fine with it, 67%, and 33% I want to go back to home. I want to return to home working. Mark, any thoughts on that at all?
Well, excuse me, we know that one of the biggest challenges that, and we're going to talk about that next, but one of the biggest challenges that employers are going to face is overall employee anxiety, whether it's in the commute or being in the office. It's interesting to me that we got, 2/3 of the people said, no, I'm fine with it. It's okay. That's a credit to their organizations for what they're doing.
Okay, all right, good. So hang on, I'm not actually sharing those. All right, there. Yeah, I wasn't actually sharing those results. So there you go, you can see them now. Ilse from Cape Town is saying we cannot participate in the polls and there are no options other than this channel and the chat. I have no idea why that would be, Ilse. I'm sorry about that. It's probably a bit beyond me to fix that. All right, well, look, there we go. Let's move on to my first real question for my guests. I'm going to stop sharing that, and here we go. And what I'd like to do, guys, from Mark and Milena, is just let's look at the high level view here. What are the big issues? What are the headlines that firms are dealing with to get staff back to the office? Milena, would you like to take that first, please?
Yeah, sure. There are obviously a number of issues that firms are facing. The first is obviously the lack of clarity from the local authorities and government. There have been a number of confusing messages in terms of wearing masks or not wearing masks. And even in the UK, we were told right from the start of the pandemic, in the beginning of the year, that masks are not really going to help us, to protect us, and all those messages were issued. But then 6 months down the road, masks are made mandatory, and they're saying, well, it's not to protect you, but it's to protect others. So firms are facing issues of making that mandatory for their staff. Will staff feel comfortable wearing PPE, while they work? Has this been effective? I mean, I wouldn't want to sit in a mask, for 8 to 9 hours a day and not be able to actually communicate to people. End of the day, we're in the office to collaborate, and a lot of firms are facing that, I guess, challenge of making masks mandatory. The same thing about social distancing. In different parts of the world, the meters would vary between 1 to 2, and then how do we actually implement that inside an office. It's really challenging looking at the open space offices that we have. How are we going to create that social distance? How are we going to maintain that? Who is going to check? A lot of teams have a culture of working together really closely. You know, how are we going to separate them? Is it feasible? How are people going to feel in the long term and the short term as well? And again, hygiene and health is very important, and there have been a number of, I guess, good reports released on that. However, firms are again facing that challenge of how do we make it good enough for people? You know, we might take a lot of steps to, you know, battle the issues with hygiene and you know, cleanse the office, but is that enough? You need to re-educate people again, and I think the number one issue that firms are facing is how do you communicate all of that to your staff?
Yeah, I agree. I mean, the comms from the government in the UK has not, as you know, contained mixed messages and hasn't been great. But I think we'll probably get to this later. But internal comms in companies is so important now. Mark, turning to you, but I have a question here from Philip, and I think Philip's in Chile, but I may be wrong about that. But I think he is, and he says this: I see the issue as building a safe environment for staff, contractors, and customers to trust that they will be safe. It's the duty of care for business owners. How do the panel see this as feasible? I mean, I suppose that's really what we're going to be talking about today, but I think trust and duty of care, those are good headlines, right, Mark?
Yeah, so a couple of things. I completely agree that the employers have a responsibility to provide a safe and healthy work environment. No question around that. Doesn't matter regionally where you are. That's just a good starting point and a good rule of thumb. Based on the stats that you showed on one of the first slides there, we also know that there's anxiety about people, you know, coming back to the office. So that's your starting point. And it's critical to understand those two pieces of information, right? Staff is already on edge about coming back, and you do have that duty of care. You have that responsibility to provide that safe environment. So there are a number of key factors that need to be put into a policy around returning to the office.
That's perfect, and that you've led me beautifully, Mark, into the next slide, which is, you know, basically businesses will need to create new back to the office protocols. If people are going to want to, you know, feel safe and trust their employer, then new back to the office protocols are going to be needed. And I know that you two, Mark and Milena, have been doing quite a lot of work on this. And I've got a little bit of a cheat sheet for you because I know that you've been looking at this, and here are some headlines for you. So Mark, do you want to dive into some of this and explain what some of this is all about, and then we can turn to some thoughts from Milena?
Yes, for sure. And actually, before you get to the return to the office protocol, I think Milena and I have been talking about this for quite a while, that it really needs to start with a very fundamental question. And that is, conceptually, to what degree do you need to return to pre-COVID-19 normal? Are you bringing people back to the office just out of muscle memory because it's the thing that you think you need to do? Or is a more of a hybrid approach workable for the long term? So what people need to be doing, and we see that 77% of the people who responded to the survey on this call aren't back in the office yet. Now's the perfect time to be looking at this, to say, okay, what's working in our current situation? What are the pain points? We know from a business continuity standpoint that we identify critical business functions and critical staff. Are those critical functions able to continue to work effectively while working either exclusively remotely or in some kind of a blended mode? Or are there pain points with them and you need to bring them back into the office? That's really important, because you don't want to just say, okay, well, we've gone from 100% to 0%. Now we need to get back to 100%. That might not be the case, and it might not be the case ever again. So going forward long term, it might be a much different approach.
I mean, this is precisely what's happened to the firm that I work for. working, I mean, we're kind of a digital company anyway, but I think the boss and everybody else who worked there found it surprisingly easy, that you know, we were continued to be productive, the firm did well when we were working from home, and I think that was quite a learning, frankly, and I you know, I'm not quite sure how that will play out in the long term, but that's a really good point. What, you know, what does the new normal look like? And it probably isn't going back to the office for 9 to 5. Milena, would you like to come in there?
Yeah, sure. I think, again, communicating to all key stakeholders is very important. And despite the limited information we may have at present moment, it's very important to keep everyone informed. And you will need to assess everyone's readiness to return. And in order to do that, you will need to launch, you know, different surveys, and you'll need to assess who is your high risk, who are your high risk employees, you know. In order to do that, you'll need to launch health assessment questionnaire. And I understand that there is a very thin line between, you know, data privacy and the legal requirement to gather such data, but it's very important to make sure that we consent to that for the safety of everyone, of our colleagues, of ourselves as well. With that health assessment, we'll be able to gain that screening, which will help us to identify who can return, who can be cleared to return, and then we can advise everyone of the new protocols. You know, what is the new physical distancing? Do they have to wear masks and gloves, you know, or are they just required to wear it before they arrive to the office? What are the standards we've achieved with hygiene? You know, are we doing cleansing every single day? Are we doing deep cleaning every 2 weeks? How are we battling the COVID-19 environment? And it's just important to make sure that everyone is aware of that. And again, where they're going to be sitting, you know, with the new physical distancing in mind, we need to be mindful of how people are returning. And of course, we should be mindful that we don't impact those working from home as well, because some of their physical PCs are based in the office, and we need to be really mindful of how are we bringing people back, when is that happening, and we need to give that notice to our teams from IT and HR to do that.
Okay, great, Milena. Thank you. Mark, do you want to pick up something on the return to office protocol? Is there something you'd like to talk about here?
Yeah, I do. I want to go back and kind of tie it into the previous question about liability, because again, going back to the need to provide a safe and healthy environment, it's important to establish that environment, but it's important to also document what your protocol is going to look like. So there's going to be things like, and we've mentioned so many of them here, to make sure that we do have protocols in place for keeping the environment clean, for keeping the employees safe through PPE, hygiene, social distancing, screening, protocols for how to deal with people who have symptoms, protocols for people who have come in contact with those who have symptoms, so contact tracing and things like that. And then making sure that that's communicated effectively, because it is important to remember, as I said a minute ago, employees are on edge coming back. They do have the right to refuse work if it is deemed to be an unsafe environment. So the employers, and I'm looking at it from both the employee's perspective and the employer's perspective, the employers need to provide that safe environment for the employees, but also have a documented protocol so that if they are ever challenged about whether or not they have a safe and healthy environment, they can very clearly lay it out. No, no, no. Here are our protocols. Here's how we're handling each of these critical areas, from cleanliness to distancing to protection to isolation and things like that.
And I suppose, Mark, like any kind of plan, whether it be a crisis management or business continuity plan, this can be changed as it goes along. But it needs to be written down. That's the point, right?
Yeah, it does need to be written down because it needs to be consistent. And you know, when we talk about here, we talked about screening, for example, and clearance to return. Those policies need to be non-discriminatory, right? So you need to build them in a way so that they apply from everybody, from the CEO to, you know, the person who comes in once a week to water the plants. And so everybody's got to follow the same rules. And yeah, they can't be in any way discriminatory. So we always like to encourage people to seek legal advice on this, and please don't take anything we say specifically as legal advice, because we're not lawyers, but definitely check in with HR and your legal teams on it as well.
Okay, excellent. Well, what I'd like to do now is I'm going to launch another poll, because I like my polls. Now, and as you can see here, this is to do with internal communication, which we talked about a moment ago. Let me launch this poll. Here we go. Launch poll. So now, please be aware that, so the question is, have you had sufficient internal communication from your employer during lockdown? Now, obviously I don't want anyone worried about bad mouthing their employer. No, I don't want anyone losing their job here. So you can make your selection anonymously. And I'm not going to share this information outside of this webinar. So I'm just quite interested to know. Could a few more people, we've got 70% of people have voted. This is quite interesting. Anybody, 75%? Come on, last few people, can you vote, please? I'd really like to know. Yeah, okay. All right, 70. We seem to be stuck on 75%. So last dibs for joining this poll. Okay, I'm ending the poll now, and I'm going to share the results. So my guess, you can see there, yes, comms have been great, it's 67%, which is good to know, right? But 33% have, feel that they could have used more internal comms. And, it's such an odd, I mean, I've always been, in my crisis management hat on, I've always been a huge believer in an emergency or crisis that internal communications are incredibly important, and sometimes areas that are missed. And now you've got the situation where you have people working from home, some people working in the office. So I think internal communications are even more important than ever. And we have huge amounts of channels at the firm that I work for. We use Slack. I know my wife works for a big firm and they use Teams. There's lots of ways for us to communicate, but it does, to some extent, it does need a bit of a top-down approach. So, Mark, what's your thought on this? Internal comms, super important, right?
Right. And so I have the opportunity to meet with a lot of different companies because I'm an independent consultant, right? And so I have different clients in different parts of the world, as I mentioned. And it's interesting to see the cultural difference. And this is not scientific in any way, shape, or form, but what I found is whether it's Teams or Zoom or Google Hangouts or even just old-fashioned conference bridges, we've stopped using kind of the old-fashioned conference bridges. I was on the crisis management team for one client, and we were having daily COVID meetings back in March, and they were all on the phone. And then somebody said, "This is nuts! Like, we have all this technology. Let's start doing Zoom calls," and that's what we did. But what we found is the people on the calls from Europe and from Canada were much more likely to go on camera, and all my contacts in the US were much more likely to just put up their profile picture and leave it at that. And I found that really, really interesting. It's not good or bad. It's just an interesting thing.
I was going to say, do you think it's better to have a picture up there? I mean, like everyone, we're using Zoom all the time. And sometimes quite often I have my camera on, but sometimes I think, goodness, I don't want to do this now and turn my camera off.
Well, what I'm noticing is that lately, fewer people are leaving their camera on. I think it's just part of Zoom fatigue. People are sick and tired of always being on camera all the time. But yes, I don't like being on camera, but I like it when everybody is on camera because you can get a little bit of a sense for body language, and you can tell whether people are, frowning or disengaged.
Yeah,
and it's
I tend to agree. Now we don't meet each other in the office. At least we can see each other on Zoom. Milena, what do you think? Are you a fan of using the camera? Is that a good way for internal comms to go?
Oh, I agree with Mark. I would rather have my camera on when I feel great and I look great, but, sometimes when we work from home, we don't always have the environment, ready for a camera, but I do feel comfortable when people put their camera on. It feels more personal. I do feel worried about the newcomers, though, those that don't know much about the company and who is in their team, and they've just joined in this COVID
Right, yeah.
times. How would they feel about putting their camera on and communicating? Would they feel isolated? How about all of those interns and perhaps apprentice that we've kind of put on the site? How are they experiencing the whole situation? Are they learning enough? How is the shadowing going with different companies? And this is very interesting. So I think having your camera on is great, but it's definitely not possible at all times.
You raise a really interesting point about new employees who don't know the other employees very well. But anyway, but with internal communication, so I guess the first thing you want to do, well, not the first thing, but an important thing to do is to share the new office protocols that are put together, and that needs to be shared. Mark, I'm guessing, obviously internally that's an important document that needs to be circulated.
Yeah, that's exactly right. And there's a few key points that need to be in that return to office communication. The rules of engagement. You need to make sure that as the employees come back, they know what to expect when they get there. The rules around wearing a mask, whether they're going to be provided with a mask or whether they have to bring their own. If they're disposable masks, what are the rules for disposing of them? How is that going to be done? Things like what to expect when you get to the building regarding things like an elevator. And it's just a quick story on that. I was talking to a gentleman the other day, and his wife works on the 28th floor of an office building. And he said, after her commute, once she gets to the office, it takes her an hour to get from the front door of the office up the elevator to the 28th floor. And then, another hour just to go down for lunch and so forth. So these are things that we all need to consider. Think about those bottleneck areas, that employees are going to have to deal with, but communicate it effectively. And one last point is to make sure that, two last points, make sure that the employees know that if they have concerns about the environment or about a staff member or about the rules or whatever it is, that they have the ability to raise those concerns to senior management without fear of reprisal.
And there's a channel to do it on as well.
That's right. That's right.
Yeah.
Really, really important. And the second really important thing is make sure you communicate early on that if conditions change, that you will revert back to a work from home situation. It's important to communicate that early. And that's because as we start to bring people back, look what's happening in the US, where 41 of the 50 states have rising numbers of reproduction rate and so forth. If those conditions change and we have to revert back to a work from home situation, you don't want your staff going, well, these guys can't make up their mind, or they don't know what they're doing. They keep changing their minds and taking us back and forth. No, no, no. This is following a prescribed protocol. We're going to bring you back. We're going to monitor everything. And then if the conditions warrant, we will roll it back. And that has always been part of the plan. It's really important to communicate that.
Okay, great. I'm just seeing here, hadn't spotted this. We've got a few things on the chat channel here. I was looking at questions, so I apologize for that. We've got, this is from Aidan to all panelists. One of the key questions we asked for first returnees was, are you happy to come back? So the 66% in the second poll probably makes more sense for that reason. So I guess that's the kind of what you were alluding to there, Mark, wasn't it? You need to ask that question, right? Are people happy to come back?
We've had, I've worked with clients, one already has brought people back into the office in the US, and their policy very clearly was when they said, okay, you're in team A that's going to come back, if that person raised a concern about being uncomfortable and they were able to work from home, they would continue to do that. I think that's the right thing to do.
Okay, excellent, excellent. All right, very good. Well, let's keep moving along here. And I have, yeah, this is another poll for you here. And this is what I raised at the beginning with those stats that I was looking at, is what about public transport? Is that a concern for people? So once again, I'm going to launch a poll on this. Public transport, here we go. What are people's thoughts on this? Hopefully you can see that. So does the prospect of using public transport worry you? Yes, it does worry me. No, I'm good with that. Not happy, but I'll deal with it. I mean, I don't own a car. I live in central London. I don't own a car. So I traditionally was using public transport all the time. And I have to a limited degree gone back to it, but nothing like I got a bike, I got a bicycle. But I do go on the tube, the London Underground, and I do go on buses. You know, I'm okay with that, I think, but I certainly not nearly as often as I did. Anybody else going to vote on this? Where are we? We've got 75%. It seems to be 75% of our audience likes to vote here. So here we go. Anyone else want to add? No, I'm going to end the poll and I'm going to share the results. Mark and Milena, you can see it there. 60% say, yes, it does worry me. And 33% not happy, but I'll deal with it. Any thoughts on that? Pretty much what you would have expected, or what?
Good, Milena.
Milena, do you want to go with it?
Yeah, sure. I think definitely in London, that's a big challenge because of the way the transport is built. It's kind of cramped. We were already struggling with it when we didn't have COVID, and thinking about going back to using the same transport method is really scaring a lot of people. But I believe the Transport of London and TfL has definitely made some good measures and has taken good steps to increase their cleanliness and you know, the wearing a mask as well. They're not allowing people that don't wear masks in. So this should hopefully help people to feel more comfortable. And of course, a lot of companies have thought of different ways of allowing people to get schemes for e-bikes, for instance, or perhaps even motorbikes or even cars, or even allow for that parking allowance. So there are a lot of things you can do, but you should definitely think about when people are arriving, because if you are telling people don't use, you know, the public transport between, let's say, 6 to 9 a.m., then what happens to everyone? You know, would they arrive after that? Would everyone follow the same advice? Would they use the cycling or e-biking? How would they feel? And companies should really think of that. And if people do worry about that, do you want them to come in? Do you want them to be exposed to that? Would you feel more comfortable to allow them to work remotely until we have a suitable vaccine? So these are the sort of questions that should be asked.
Okay, good. Mark, what's your thought on public transport, please?
Well, we know from a contact tracing perspective that there's three different types of things that constitute contact. One is physical contact, and you could certainly have some of that in public transport. But then there's also close contact, which is within that 2 meters for a period of 15 minutes or longer. And that definitely applies to public transport. Wearing of the masks would, in my opinion, be absolutely mandatory. But I mean, there would still be, I suppose, you know, a chance of transmission even with masks. But you know, thinking about contact in that regard on public transport, yeah, I would put myself in that, yes, it does worry me phase. If you look at these results, 93% aren't happy with it one way or another. Not happy with it, I'll deal with it, or yeah, it worries me. So I'm much aligned with those people.
Would you go on public transport now?
It would have to be a very unique circumstance. Right now, I have a little bit of freedom, again, being an independent contractor. I'm starting to exercise a little bit more of an assertive approach with things like that. And I would say to a customer, for example, in downtown Toronto, the best way for me to get there would be public transport. And I would probably tell them no until, you know, through the rest of this year, for example, I'm doing all my meetings virtually. So right now I would say no.
Okay, oh, that's very interesting. We got another question from Philip, and sort of something that Milena was talking about. He says that a lot of the polls that I've been running today are about perception, and I think that perception, it plays a big role in this. Um, so he says, is it worthwhile for companies to have constant polling of staff? And if it is, should it be daily or weekly? I'm guessing daily might be a little bit much. But what about that as another part of internal comms, certainly for big companies? I mean, surely that would be, what's your thought on that? Is that worthwhile to poll people's perceptions on a regular basis? Milena, do you endorse that or not?
You definitely have to be careful of how many times you address your staff, and you
Yeah.
need to consider who are you going to target. Are you going to target only those that are returning? Definitely on daily basis is way too much, and I would even say that you should do that every maybe 3 or 4 weeks. And you need to think about your phased return. Who are you bringing back first? Do you have a high risk category that you want to postpone for 2021, for instance? But it's definitely important to ask people how they feel. How would they commute to the office in this new world? How would that look like? What are their top concerns? And they'll be able to tell you that. And in order for you to know, it's good to raise those questions.
Okay, that's great. Don't forget, guys, any more questions? You can put my guests on the spot here. So for the wider audience, if you want to put some questions in, now's the time to do it, because I see, goodness, we're 45 minutes into this already. So if you want to raise your questions, now is definitely the time to do it. So I'm going to go back now to another poll, and I'm going to ask you this question. Let me launch this poll now. And so the question is, oh, hang on, I can put my slide up too. Oh, no, we've done that one, Jim. Come on, keep with the program. Are you comfortable with downloading and using a government contact tracing app? Now, this is something that has got off to a pretty poor start in the UK. There was meant to be a contact tracing app, but it's not in wide circulation now, and the government has to some extent not done well on this issue. Mark, can I ask you, is there any kind of, what about contact tracing in Canada? How's that being addressed?
Probably not as much as I would like to see. I just finished a course through Johns Hopkins University on contact tracing.
Oh, right. Oh, well, you're the man to ask then.
And I got to tell you, it is absolutely fascinating stuff and extremely valuable in reducing the transmission rate, the reproduction rate of the virus. Just a couple of interesting stats about this, and then we'll get to your poll. So first of all, 50% of people who contract COVID-19 show symptoms within the first 5 days. 95% show symptoms within 14 days. That's why you hear so much about the 14-day period. Of course, we know that some people don't show any symptoms at all, right? They're asymptomatic. But as far as being contagious, people are actually contagious 2 days prior to when their symptoms first showed up. So from the time of contracting the disease until their infectious period, their contagious period, that's generally thought of as about a 3-day window. So it's really, really important that when we identify somebody as a case, somebody who has COVID-19, that we go back 2 days prior to when they started to develop symptoms and try to identify everyone that they came in contact with. So that's physical contact, close contact within 2 meters for 15 minutes or longer, or even proximity contact, which is further than 2 meters, but for an extended period of time, like sitting next to someone in an office for the entire day. Now, I'm much more comfortable talking about contact tracing in the workplace. And so if we were all in the same office, I would say, okay, I would be much more comfortable talking to Jim about coming in contact with Milena, not talking to Jim about coming in contact with his, dentist or someone at a restaurant or someone at a pub. I almost said barber, and I realized that might not have been a best example. And so, you can shoot me later for that. But you know, that's
I don't know why I put up with you. Honestly, all I get is abuse from you. Go on. I'm sorry to interrupt. Go on.
It's because I'm otherwise a delight. So I would, you know, I'm not as comfortable with more of the public health contact tracing. I like to focus on inside the workplace,
Well,
but
I mean,
it is absolutely critical.
And there you go. And you can see the results from this poll. And I know it's a small poll, but it's quite interesting. So like 70% of people are not crazy about the idea. I mean, this is the first poll where I'm quite surprised about that. So I guess it's data privacy people are worried about. It'd be quite interesting to dig in a little deeper. In fact, actually, let me ask the audience, the wider audience, for people who said maybe not sure and no, what is it about downloading and using a government contact tracing app that bothers you? Why does that bother you so much? Can you put something up on the chat channel or on questions? Because I'd really be interested to know about that. I assume it's data privacy that people are worried about, people's credentials being hijacked or whatever. Milena, are you surprised at that poll, or is that reflect what you think as well?
I was definitely thinking that people were going to say no,
Were
but
you?
I'm
Okay.
surprised that it's maybe. Definitely data privacy is probably the #1 consideration here, because people won't be comfortable if their system is not fit for purpose. What if it gets attacked? What if your data gets stolen? The end of the day, this is something that was created really quickly, and there wasn't much of security and architecture plan behind it, hence why the delay in releasing it here in the UK. But I know it's very important, and it can definitely help. But there are other tools for employers that could perhaps utilize those and track who is in the office, when were they there, as Mark mentioned, 2 days ago, when the symptoms are starting, who was near these people, and this will definitely help. But yeah, data privacy is one of those.
We've got a few comments here from the audience that I'd like to share with you. So Janet says data security is the big issue, which we can understand. Philip says contact tracing systems must be 100% watertight for data privacy with real guarantees. Nick, I assume he's in the UK. He's a bit critical of the government privacy and lack of government competence to date. Certainly in the UK, the track and tracing system has not shown a huge amounts of competence. Aidan cites Cambridge Analytica. Government don't have a great record in the contact tracing space either. So there is clearly, I mean, if we ever do get a contact tracing app here in this country, it's going to be a problem. I think in Singapore they have one, but Singapore is a much more top-down authoritarian government, and I think you literally can't go into shops and so forth unless you've proved that you have downloaded the government app. But I'm not sure that's going to play in the UK, and I'm not sure that's going to play in Canada either. So I mean, what we're looking at here is people really want to be confident that the data is secure, that the tracing app is secure, and people are clearly not feeling at the moment that they are. Okay, all right. So,
I love some of these
Mark, go ahead.
comments. Some of the comments that people are putting in here, and I miss the names because they kind of fly by my screen kind of quickly. But someone just mentioned, the data gathering that goes on from a government issued contact tracing app against GDPR, and how those two things don't seem to reconcile, and that's absolutely true. It's really interesting. So I'm originally from the United States, so I'm American. I moved to Canada, become a Canadian citizen. So I know a little bit about what I'm talking about. And I want to promise you that this next statement is not political. I'm not making a political statement. But in the United States right now, there is an opinion that forcing people to wear masks is taking away their freedom. I'm not sure I understand it, but that is a reality. Can you imagine if on top of that, the US government put out an app that said, we're going to trace you for contact tracing? That's never going to fly. It'll never happen.
Wow, that's a really interesting point, Mark. So people are just not going to do it in huge numbers, right?
Yep.
Really good.
Yep.
Really, really interesting. Okay. All right, guys, we're getting towards the end of this webinar, astonishingly. So do keep questions and chat coming. But what about a short and seemingly simple question, but I'm guessing it's not quite so simple. So when it comes to COVID, when it comes to pandemic planning and so forth, what's the employer liability? What responsible would you lay at the door of the employer? Who wants to take this? Mark or Milena? Who's going to go with this?
Mark, go ahead.
Yeah, please, Milena, go ahead.
Yeah, Mark.
You
Oh,
want me to
sorry.
go? Okay, that's fine. We've talked about this a little bit. So again, the employers have the obligation to provide a safe and healthy workplace. OSHA is kind of a leader in this, at least in North America, and they talk about having a workplace that's free from recognized hazards that are causing or are likely to cause death or serious physical harm. Certainly COVID-19 fits into that category. So we talked about before having good physical distancing, capacity limitations on number of people in the building, following government guidelines, and taking government guidelines as the minimum standard. Don't try to stretch the government guidelines or try to break through. This is not you doing your taxes where you're looking for loopholes here. Take the government guidelines as the minimum standard and exceed them to be even safer. Make sure you have good communication in place, protocols for dealing with safe people or with sick people, keeping people safe and so forth. It's really important for two reasons. Number one, remember your employees can refuse to work if the environment is not safe. And if you think about the reputational and operational impact, we look at this from a business continuity standpoint or crisis management standpoint, the reputational or operational impact of employees en masse refusing to work, it's not acceptable. It's not an acceptable risk. The other thing is you can be sued. I have some notes here. Amazon was sued by some employees because the employees said they were explicitly or implicitly encouraged to continue to attend work, and they were prevented from adequately washing their hands or sanitizing their workstations. Again, if you have the right policies in place and they have them documented, that will go a long way. By the way, the Amazon employees said that when they raised their concerns to senior management, HR told them that they should just keep quiet. So these are things obviously you want to stay away from doing, but think about all the components that we've talked about and have that formally documented policy.
Great. Milena, is there anything you wish to add to that?
No, I think Mark was pretty comprehensive. I did wanted to add a little bit about the contact tracing, which I found quite interesting. In Israel, they didn't ask people to consent to their location, but they used one of their local telecommunication company to actually track the whereabouts of people that have been in contact with those positive COVID people. That was really interesting. And another interesting fact I wanted to mention was how a few countries have handled the COVID spread. Like, for instance, Vietnam is really praised. They have 97 million people and they haven't had a single death because they had a very bad SARS in the 2000s, and they learned that they need to stop it right from the border. They learned that everyone that comes in needs to be isolated and tested for a significant period of time, and they've managed to kind of deal with that right from the start. I think Germany is also really praised of how they've handled the situation because of the number of cases and deaths they had. So there are a lot of things we can learn, but first of all, we need to have our governments be a little bit more clear and have the right, I guess, practices and planning in place for everyone else. Because as we've seen, simple things like PPE was not available for a lot of the, medical organizations and hospitals. So that was really shocking. So it's going to be good to see that the governments are really prepared. So then we can be prepared as well.
Well, we hope so, because because I mean, there's all the talk about the second wave of the pandemic as well, and maybe having to lock down again. Now, whether it will go, whether in the UK it would ever be a countrywide lockdown again, we don't know. But certainly, certain cities will be locked down again. So I think, that you have to cut the government some slack on this, although I know some won't. But this is a very new problem. This, but certainly communications from the UK government certainly could have been better. And I feel that as you said, Milena, whether we should wear masks, whether we shouldn't wear masks. Initially we were told they were no good. Now we're told we have to wear them. I think that kind of communication is incredibly frustrating. People just don't know really what's expected of them, and I think that's unfortunate. Right, Mark, we're kind of wrapping this a little bit now. So this is really my last question. What are the big, if we can sort of sum up where we are, and the question I'm going to ask you is, what are the big challenges facing getting workers back to the office? And what are your top tips for firms? What should they be doing? What should they be looking at? What are the areas that they really need to focus on? Can you help us with that, please?
Yeah, so I'll pick two, and I'll leave a couple for Milena to jump in
Sure,
on here
sure.
too. So the two that I would say would be more on the emotional side, and then I'll let Milena talk maybe about the environment and so forth. But for me, it's employee anxiety. We know from the stats that you showed at the top of the webinar that 2/3 of people are anxious about this, and it's probably more than that. And so organizations need to be aware of that, give their employees a channel to raise concerns. And then the other thing is, and it almost seems counter to what I just said, but pandemic fatigue is a real factor. And so we need to understand that some people are just sick and tired of the whole thing. They're Zoom meetinged out. They're tired of hearing about masks. They're tired of worrying about social distancing. And so it's easy in those situations, as we get into the gray areas of this, right? We're not locked down, we're not fully open, we're somewhere in the middle, for people to let their guard down, and that can be a dangerous thing. So I think those are two challenges to keep in mind.
So how do you, this is an almost impossible question, but how do you combat this pandemic fatigue then? What do you do? I mean, people are fed up with it.
They are. My view of it, and this might be a little too simplistic, is within the workplace, here are the rules, here's the policy, you will follow the rules. Because if you get people who say, well, I'm not wearing a mask in the office, it's just too much, I'm just not doing it, then that's not the policy. They're not following the policy. They're putting other people at risk. And it just raises other questions and concerns. So for me, I think you just have a consistent, non-discriminatory, equally applied policy.
Yeah, I hear you. It's just, I must say, as Milena said at the beginning, wearing a mask for 8 hours in the office, that's a tough ask, right? But yeah. Milena, let's pull this together for us, for our audience, please. What do you see as the big challenges, and what are your top tips for firms and staff in going back to the office, please?
I think everyone needs to take that time to plan and prepare their environment, whether it's staff returning or whether it's staff continuing to work remotely. Companies need to be flexible. They need to communicate, and they need to set the right expectations. They need to question all of their assumptions. Just because they've managed to be online for the past 3-4 months doesn't mean that people are actually able to perform their work effectively. Have you thought of that? Have you I guess given that allowance to make their environment better? Is that even possible? And again, I would say that there is no one solution for everyone, so people will need to consider that. They will need to understand that they should just not overwhelm their staff. They should not overwhelm certain departments, and they should take the time to prepare everyone, give that notice in advance, and probably it's the right time to invest in technology and think about that new normal. Where is your company going, and how quickly do you want it to go there? So these are the two very important questions you need to ask yourself.
All right, guys. Well, I think that, thank you very much indeed, both of you. I think that we'll draw the webinar to a close now. It's been a fascinating discussion. Thank you very much for your insights. It's been really worthwhile, and I hope all the people listening have found it so. It just really remains me to thank Mark and Milena. So thank you very much indeed.
Thanks for having us, Jim.
Yeah, I hope to speak with you soon. Our next webinar, which I think is going to be under the auspices of the BCI, the Business Continuity Institute, will be in September. And I think we're going to be looking at business continuity and crisis management in the sort of post-COVID world. Well, it's not post, is it? In the sort of how COVID or the pandemic is shaping business continuity and crisis management. And I'm sure, Mark, you've probably got some thoughts on that right now, but we're not going to get into that right now. So that's going to be in September. So I'm going to wish you all goodbye. Thank you so much for listening. Have as good a summer as you can, and we'll see you next time. Bye bye now.
Take care. Thank you.